This video is from a live stream where I did a full breakdown of what you need to know before starting Zepbound. I cover side effects, dosing, safety tips, and what the official Lilly site actually says. So many people miss this stuff or they get their information secondhand, so I wanted to walk through it clearly and have it all in one place. If you're starting or even just considering Zepbound, my hope is that this will help you feel more informed and prepared. It's an injectable prescription medication that may help adults with moderate to severe obstructive sleep apnea and obesity improve their obstructive sleep apnea. And that is something that I was diagnosed with when I was in the Army. So that was definitely a struggle of mine. And so it says on here Zepbound should be used with a reduced calorie diet and increased physical activity. So I think maybe people miss that part, the increased physical activity. It's definitely important to have all of this together, right? Zepbound is a tool, but we want to make sure we're making better choices with what we're eating and we're moving our bodies. Now, it's not telling you you got to run a marathon or you got to, bench press 600 pounds or anything like that. Just increase physical activity, which I take to be more than whatever you were doing before you started on it. Okay. And the active ingredient is terzepatide. So it should not be used with anything else containing terzepatide or any other GLP-1 receptor agonist medication. So you should not be taking this as the same at the same time as Wegovy or, you know, I'm not really well versed on the other GLP-1s. I just know about semaglutide and tirzepatide, right? We have under semaglutide, we have Wegovy and Ozempic, and under tirzepatide, we have Zepbound and Mounjaro, however you say it. So that's just I just wanted everyone to see reduced calorie diet and increased physical activity. Okay. And the different doses, right? We're gonna go through the doses. Bear with me. I'm just scrolling down. Actually, you know what? Before we go to the doses, I want to go through the side effects. So I see those questions a lot. Now, for some people who have the concern about, oh, should I take this? Is this safe? Here we go. So it may cause tumors in the thyroid, including thyroid cancer. Watch for possible symptoms such as a lump or swelling in the neck, hoarseness, trouble swallowing, or shortness of breath. If you have any of these symptoms, tell your healthcare provider. So again, you don't want to, if you're having any of these symptoms, you don't want to run to the internet and ask people what their opinions are. You want to call your healthcare provider because those are signs of something serious, right? So you don't want to use Zepbound if you or any of your family have ever had a type of thyroid cancer called medullary, and I'm probably pronouncing this incorrectly, but medullary, hold on, we lost thyroid carcinoma, also known as MTC. Do not use Zepbound if you have multiple endocrine neoplasia syndrome type 2. Do not use Zepbound if you've had a serious allergic reaction to tirzepatide or any of the ingredients in Zepbound. So if you're having some sort of reaction, don't continue to take the medication. Reach out to your healthcare provider. I have seen in different groups, different people saying, they've been vomiting nonstop, severe diarrhea. Should I keep taking the medication? Talk to your provider. Talk to your provider. That is what they went to medical school for. I'm not saying specifically to do this, but you're supposed to reach out to your provider. Okay. And then let's go over some of the serious side effects that you could have. Severe stomach problems, right? That's been reported. Again, tell your healthcare provider if you have any stomach problems that are severe or will not go away. So I want you guys to, really, really listen to this, okay? Kidney problems, kidney failure, diarrhea, nausea, and vomiting may cause loss of fluids, which is dehydration, which may cause kidney problems. It is important for you to drink fluids to help reduce your chance of dehydration. So, again, making sure that you drink fluids. Now, I'm a big, I believe in just drinking water, right? Not that you can't drink anything else, but water. They're not telling you specifically to drink water, but you want to make sure that you're drinking a lot of fluids because you don't want to end up getting dehydrated and causing kidney issues. So the medication itself doesn't cause the kidney problems. It's from being dehydrated, you know, that can cause that. So that's important. Gallbladder problems. Gallbladder problems have happened in some people who use Zepbound. Tell your healthcare provider right away if you get symptoms of gallbladder problems, which may include pain in your upper stomach, fever, yellowing of the skin or eyes, which is jaundice, or clay colored stools. So, again, if you have these issues, reach out to your provider. Inflammation of the pancreas, pancreatitis. Stop using Zepbound and call your healthcare provider right away if you have severe pain in your stomach area that will not go away with or without vomiting. You may feel the pain from your abdomen to your back. So, again, I've seen a lot of questions that they're answered right here on Lily's website. Call your provider. Okay? Serious allergic reactions. Stop using Zepbound and get medical help right away if you have any symptoms of a serious allergic reaction, including swelling of your face, lips, tongue, or throat, problems breathing or swallowing, severe rash or itching, fainting or feeling dizzy, or very rapid heartbeat. Immediately. That seems, I'm interpreting this as you probably should go to the ER if you have these. Um, Low blood sugar, hypoglycemia. Your risk for getting low blood sugar may be higher if you use Zepbound with medications that can cause low blood sugar, such as, hmm, sulfonylurea. I'll spell it Sulfonylurea, or insulin. Signs and symptoms of low blood sugar may include dizziness or lightheadedness, sweating, confusion or drowsiness, headache, blurred vision, slurred speech, shakiness, fast heartbeat, anxiety, irritability, mood changes, hunger, weakness, or feeling jittery. And those of you who struggle with that, you probably already know that. But if you're finding yourself like I would not have ever known what to look for as far as low blood sugar, right? Hypoglycemia. So make sure if you're having these issues, you reach out to your medical provider, okay? Changes in vision in patients with type 2 diabetes. Tell your healthcare provider if you have changes in vision during treatment with Zepbound. I have seen a lot in the groups of people complaining about vision changes. That's on here. Contact your healthcare provider. Depression or thoughts of self, I'm not going to say the word because I don't want to get flagged or anything, but I'm sure you guys can see it. Hopefully did I make it big enough? Um, yes, depression or thoughts of harming yourself. You should pay attention to changes in your mood, behaviors, feelings, or thoughts. Call your healthcare provider right away if you have any mental changes that are new or worse or that worry you. So even if don't dismiss anything. If you feel out of character, like something is wrong, reach out to your doctor. Okay? We're not reaching out to Facebook or YouTube or anything. We're going to reach out to our doctors if we have any of these issues. Okay? Um Here we go. Food or liquid getting into the lungs during surgery or other procedures that use anesthesia or deep sleepiness, which is probably why when we go in for our colonoscopies, because we are being put under light sedation, that's probably why they have us stop for, the week leading up. And some providers even say 2 weeks. Um, Zepbound may increase the chance of food getting into your lungs during surgery or other procedures. Tell your healthcare provider, tell all your healthcare providers that you are taking Zepbound before you are scheduled to have surgery or any other procedures. Now, in a perfect world, everybody's looking through our medical notes and they're on top of it. we still got to tell people. We got to let them know, okay? And now we're going to go over the common side effects. The most common side effects of Zepbound include nausea, diarrhea, vomiting, constipation, stomach or abdominal pain, indigestion, injection site reactions, feeling tired. So, those of you who complain about feeling tired, that is a common side effect. Okay. Lily is aware of this. So, you don't have to feel like, oh my God, is something wrong? This is the side effect that's listed here, okay? Allergic reactions, belching. I hear people talk about the sulfur burps. I've not experienced that, but I'm assuming that that's tied into that. Hair loss. So many people wonder if their hair loss, it's normal for some people. Now, it says common. That doesn't mean everybody's going to get it, but we have heard, right, of a lot of people losing their hair. That's on there. And heartburn. These are not all of the possible side effects of Zepbound. Talk to your healthcare provider about any side effect that bothers you or doesn't go away. So, again, and I know that I'm saying it a lot, contact your healthcare provider. Okay. And so, if you have those, it tells you, um, you can let your doctor know, and then they have a number that you can call, which is the FDA, right? You want to dial 1-800 FDA 1088. So that's another place that you can report. All right. We're getting down, okay? We're getting through this. We're getting through this. Hang in there with me, okay? Before using Zepbound, your healthcare provider should show you how to use it. I'm amazed at the amount of people that don't know how to use it. Now, I have to be honest, my healthcare provider didn't show me how to use it, but we're going to get to that because that's also on this website, okay? Tell your healthcare provider if you're taking medicines to treat diabetes, including an insulin or, I don't know how to say the other word, which could increase your risk of low blood sugar. Talk to your healthcare provider about low blood sugar levels and how to manage them. If you take birth control pills by mouth, talk to your healthcare provider before you use Zepbound. Birth control pills may not work as well while using Zepbound, and I have seen many stories of people getting pregnant while they're on this medication. So, if you're on a birth control pill and it's oral, make sure your doctor knows that you're taking Zepbound. Okay? Your healthcare provider may recommend another type of birth control for 4 weeks after you start Zepbound and for 4 weeks after each increase in your dose. So it's not even just that initial one. This is an ongoing thing. Okay? And then there are some questions, right? I'm going to go through these really quickly. Review these questions with your healthcare provider. Do you have other medical conditions, including problems with your pancreas or kidneys, or severe problems with your stomach, such as slowed emptying of your stomach, gastroparesis, or problems digesting food? Do you take diabetes medicines, such as insulin, or the word that I'm not sure how to pronounce properly? Do you have a history of diabetic retinopathy? I think is how you say it. Are you scheduled to have surgery or other procedures that use anesthesia or deep sleepiness, deep sedation? Do you take any other prescription medicines or over the counter drugs, vitamins, or herbal supplements? So, a lot of you that want to go out here and take all this extra stuff, let your doctor know, let your providers know to make sure that you're not doing anything that's going to have some sort of reaction. Okay. And then, are you pregnant, plan to become pregnant, breastfeeding, or plan to breastfeed? Zepbound may harm your unborn baby. So tell your healthcare provider if you become pregnant while using Zepbound. It is not known if Zepbound passes into your breast milk. You should talk with your healthcare provider about the best way to feed your baby while using Zepbound. I would feel safe to say that if you get pregnant, it's probably best to discontinue taking it. And if you plan to breastfeed, it would seem from here that maybe you should wait until you're done with that phase, especially with them not having enough studies to know if that could pass through to your baby. And I know, we wouldn't want to do that, right? So now it's telling you how to take, right? Here we go. Read the instructions for use that come with Zepbound. So everybody's box comes with instructions in it. And those of us that are on the name brand, we know that. The instructions are in there, okay? You want to use it exactly as your healthcare provider says, not what the internet geniuses say. You want to do exactly what your doctor tells you to do. And if your doctor didn't give you specific instructions, they're in the box, okay? You want to use Zepbound with a reduced calorie diet and increased physical activity. So a lot of you that say you just want to do everything the same, it's telling you that you need to do a reduced calorie diet. It doesn't say starve yourself. It just says reduced calorie and increase physical activity. So Zepbound is injected under the skin subcutaneously of your stomach, which is your abdomen area, right? Your thigh or upper arm. Okay. I don't see anything on here that tells me that one site is better than another. It doesn't say that at all on their website. Okay. Use Zepbound one time each week at any time of the day. So I think that it's best to take it, see how you react to it, and then you determine what schedule is going to be best for you. I have taken it in the morning, I've taken it in the afternoon, the evening. I have not noticed anything. I haven't had any side effects. But if you have, if it makes you tired, adjust accordingly, right? But know that it's a normal side effect. So they want you to rotate your injection site with each weekly injection. Do not use the same site for each injection. So if you did your right side of whatever part you did it, don't do that same exact part next time. So if you do your left arm one day or one week, do your right arm the next week. Don't do the same. It's telling you not to do that. Okay. Um, and if you take too much somehow, call your healthcare provider, seek medical advice promptly, or contact poison control. Okay. I know that some people that are on the compounds, they can adjust however much, and I have seen where people have said that they accidentally took too much. So, according to Lily, if that happens, you should be contacting a medical professional. Okay. All right. And so here we go with the doses. We have 2.5, 5, 7.5, 10, 12.5, or 15. And that's in a single dose pen or a single dose vial. Okay. It's a prescription medicine, as we all know, right? You can't just get it off the street. Okay. So that is that. I want to go through another part and then we can get into something else. Okay. I want to go to how to use. All right, you got this. Your once weekly Zepbound routine. Now, when I'm saying once weekly, I don't see anything about microdosing on here. Okay. If you've worked with your provider and they say to space your doses out or whatever, if that is what your doctor is telling you to do, then disregard what I'm saying. But I'm looking on their website. As you guys can see, this says once weekly. Okay. And it comes in a single dose pen that requires no mixing. There's no need to see or handle the needle. You can take it right at home with or without food. It's another question I see frequently. With or without food, that's your choice. Okay. Now, if you just want to see how everyone else is taking it, that's different. That's fine. But asking when you should take it, it doesn't matter. It doesn't matter what time of the day and if you take it with or without food. And again, it tells you where you can do it, right? Your stomach, your thigh, back of your upper arm with another person's help. Do not use the same exact spot week to week. And ask your healthcare provider to help you choose an injection site if you're not sure. Okay? Doesn't say go to Facebook or Reddit. And I'm not trying I'm trying to be funny a little bit, but I'm just, trying to drill it in that you need to be talking to your healthcare provider. All right? Um I'm not going to play this video, but here's the diagram. And this comes inside the box as well. So you see that we've got the stomach area here. We've got the uh, front of the thighs and then the back of the arms. And then those of us that have taken it before, and if you haven't taken it yet, you're going to take off the cap. You apply it to the area unlock it, and then you press it in. And I actually do it the same way that they have it here. So, and then this is the part that I want you guys to see. Here we go. Even if you don't feel a poke, if you hear 2 clicks, the injection is complete. You will know you're done when the gray plunger is visible. Okay? All right. So I think we're good here. I think we're good here. Um, how to store it, right? We want to keep it in the refrigerator, 36 to 46 degrees Fahrenheit. You can also store it at room temperature for up to 21 days. Okay, so if you accidentally leave it out, just know you have 21 days to use it. Do not return the pen to the refrigerator after removing it. Okay, if it hasn't been used within 21 days after removing from the refrigerator, you want to throw it away. Do not freeze it. If it's been frozen, throw it away. So if something happens and, if you have something happen to your medication, you can reach out to Lilly and they're really good about, you know, uh, sending you out a voucher to be able to get another box. Okay. You can have a pen misfire and they'll still take care of you. So I just want you to know that you can reach out to them. Okay. And the disposing, right? They have sharps containers. So you can use a FDA cleared sharp container, which is their recommendation, or a detergent bottle. I've seen that question a lot too. What do you do with your pens? Well, you put it in a sharps container or you put it in a detergent bottle. Or you can be a weirdo like me and just have a collection of them in all the boxes. All right, we're almost done, okay? Let's see. Here we go. This is it. Zepbound dosing is increased gradually over time. The starting dose is 2.5 milligrams because I know that we've had some battles in some comments section. The starting dose is 2.5. Okay. After 4 weeks, your doctor will increase the dose to 5 milligrams. After at least, it doesn't say if you don't lose weight or whatever. It doesn't say that. It says after at least another 4 weeks, your dose will increase by 2.5 milligram increments until you find the dose that is right for you. So if you go to 5 and you notice, oh my gosh, 5 is not working, according to Lilly, you're going to be on that for 4 weeks before you go up. Okay. The recommended maintenance dosage for obstructive sleep apnea is 10 milligrams or 15 milligrams once weekly. Okay. 2 point, and here we go. Here's an example of a doctor prescribing it different than what Lilly is saying. It says 2.5 milligrams is not intended for maintenance use. Okay. And the maximum dose currently is 15 milligrams. So that's it. That's it. So you see, even on their website, this 2.5, that says starting, guys. It says starting. It's a starting dose. And yeah. So if you miss a dose or want to change your schedule, hold on. If you miss a dose, take it as soon as possible within 4 days or 96 hours of your scheduled dosing. If more than 4 days has passed, skip it and just take it at the next regularly scheduled time. Okay. Do not take 2 doses of Zepbound within 3 days of each other. And if you want to change the day of the week, make sure there's at least 3 days between. So if your insurance doesn't cover it, you have self pay, and that's available through Lilly Direct. Now, your provider would have to send it over there. So your provider sends the prescription over and they're able to fill it for you. So if you're just starting, the 2.5 milligram vials are only $349. And I say only because it's a lot less than $1,200. So $349 a month. And then for the 5, 7.5, and 10, those are $499 a month. So again, um, a lot cheaper than $1,200. So those are the options for you as far as name brand. Those are the options if your insurance doesn't cover it. Whether you're just thinking about starting Zepbound or you've been on it for a while, this journey looks different for everyone. So if you've learned something new or if there's something you wish you knew earlier, Drop it in the comments. Your experience could really help someone else. And remember, we can share our journeys, but we should never compare them. Bye.